The surprising and good news about type 2 diabetes is that you may live longer and better than ever before with the disease because treatment is so much better. However, according to a recent news report, only 7% of patients with diabetes get all the care they should. The key is an aggressive, stepwise approach, moving to the next step early enough to keep ahead of the disease. We went to the prestigious Joslin Diabetes Center in Boston, affiliated with Harvard Medical School, to find out how. First is diet and exercise, which has a very powerful effect.
Exercise sensitizes muscles to insulin, which helps people control their weight. It reduces stress. Exercise is absolutely fundamental to good diabetes control.
For those who are rigorous about diet and exercise, it can be the only step you need. The next step is to add a medication that you take by mouth called oral agents. There are several types of these medications, such as metformin. The third step is to add an injectable medication, such as insulin. The last step is to add a long-acting insulin. As a patient, it's important you take control of your own care because physicians don't always move patients to the next level soon enough. As a patient, if your A1C remains high and your blood sugar is hard to control, be sure to ask your physician about more aggressive treatment.
We teach everyone to do finger stick testing of their blood glucose so they know how the food they eat, the exercise they do, and the medications they take are affecting their blood glucose.
People with type 2 diabetes, unfortunately, are more likely to have some other problems. They're more likely to have heart disease, they're more likely to have high blood pressure.
That puts managing heart disease risks at the top of your list of priorities. High blood pressure, for instance, is often overlooked in treatment but can dramatically increase the risk of heart attack and stroke. Another important blood fat in diabetes is the triglyceride, which is very sensitive to controlling your blood sugar levels and the amount and quality of carbohydrate you eat. Bring your A1C down and you'll bring down your triglycerides. Here are those key numbers to hit. Triglycerides below 170. HDL more than 40 for men, more than 50 for women. LDL below 70. Blood pressure at or below 130/80. A1C less than 7% provided that achieving this goal does not increase the risk for developing low blood glucose. Good diabetes management can help you keep free of the complications of diabetes from loss of vision to heart disease. You'll also feel dramatically better. Spending time with a certified diabetes educator is an investment that will pay enormous dividends.